Hello, my name is Nicole Markowitz, and I'm a Doctor of Occupational Therapy student at the University of North Dakota in Grand Forks. This is my presentation about how to address sexuality with young adult patients who have cancer. The purpose of this scholarly project is to address the needs of young adult patients with cancer by providing a referral system to various disciplines in order to promote holistic and preventative care. One area of need for this unique population includes addressing sexual health and activity. The various drugs and procedures used for cancer treatment often impact sexual functioning and sexual health. However, due to social norms, this can influence how often healthcare providers have conversations about sexual health with patients. Not having these conversations can lead to a significant impact on emotional, mental, and physical health for the patient. Some things that it can lead to include lower quality of life, a loss of identity, and an impact on existing or future relationships. The importance of discussing sexual health. So patients typically wait for healthcare providers to initiate conversations about sexual health. Meanwhile, healthcare providers wait for patients to mention concerns about sexual health. It's typically common for patients not to mention anything about sexual health, so it's important that healthcare providers take the responsibility of asking the difficult questions and starting that conversation. However, knowing how to navigate a conversation about sexual health can be intimidating. With practice and time, the healthcare professional can begin to feel more comfortable addressing this topic. So then in order to do that, I use the recognition model. I put together a flowchart, but it's used by healthcare teams to address sexuality. So it consists of 5 stages, the first one being recognition of sexual needs, and then gathering permission to talk about sexual health, exploring concerns, addressing concerns within the professional role, and then providing referrals as necessary. Alright, so this is a big overview of the process. I'll go in depth into each stage as the presentation goes on, but we start with stage 1, then work to stage 2, and then stage 3. Then from stage 3, we can either go to stage 4 or to stage 5. And then if we're going to provide a referral, it's important to know who do we refer to and what kind of interventions they provide. So I have those listed as well. Right, so moving on to stage 1, this is recognition of sexual needs for the patient. So within this stage, it's important to provide a statement that normalizes, affirms concerns, validates them, and also recognize your limitation as a healthcare professional. So I put together some statements, and I'll just kind of walk them through. So the first one being, many young adults have concerns about how cancer treatment could affect their sexual health and activity. This is an important aspect of life, and I want you to know that there are resources available if needed. And then here's another one. Sometimes young adults feel like they don't get enough information from their providers about sexual health. It is common for patients to feel like cancer has affected their sense of intimacy or romantic relationships. Often, these issues are treatment related, and there may be some things we can do to help. So these are just some examples. Feel free to use them or use a combination of both of them and make something that you feel comfortable saying to patients as well. Alright, so then the next stage is all about gathering permission to talk about sexual health with patients. And we can do this by simply saying what concerns you have at this point in time. And if the patient does not have any concerns, we can either end the conversation there and address side effects to watch for, or if they do list concerns, and then we move into stage 3. Alright, so then stage 3 is all about exploring concerns. The purpose of this stage is to gather more information from the patient about their concerns. So then we do this by using open-ended questions, using empathetic listening skills, acknowledging the impact on their relationships as well as their identity. And then lastly, we want to thank the patient for sharing. This topic requires a lot of vulnerability, honesty, and just being willing to share. And that takes a lot of strength and courage, so we just want to be cognizant of that and thank the patient for sharing their concerns with us. Alright, and then next we can either address the concerns within our scope or we can refer on. So then stage 4 is addressing the concerns within your role in the interprofessional team. And we can do this by providing more information, providing education, and then we can move to stage 5 of providing the referral. And then to do this, we want to use clinical judgment and recommend a referral as necessary. If the patient is open to a referral, there are many different specialties to think about. This slide covers the sexual medicine department and all the kind of specialties that fall within that department. The first one being OBGYN. They cover women's health, and then urology. They specialize in urinary tract and reproductive conditions. And there's a certified sex counselor and advanced registered nurse. She provides counseling and treatment of conditions that affect sexual functioning. Some interventions she could provide include education, lubricants, dilators, meditation strategies, mindfulness strategies, counseling, and medications. Pelvic floor PT, this includes strengthening of pelvic floor muscles. And then some interventions that they could provide include manual therapy, various exercises, dilators, stretches, mindfulness strategies, and pain management strategies. It's important to note that all of these specialties work together as a team. OBGYN visits are more likely to be covered by insurance, as well as more people may be more likely to see an OBGYN as compared to a sex counselor. And then you can also refer to rehab. Occupational therapists are skilled at encouraging participation in meaningful and everyday tasks, including sexual activity. So, some things that we could focus on include positioning, range of motion, endurance, energy conservation, adapting and modifying tools, as well as communication strategies. Alright, so then just as a summary and ending on an encouraging note, I just want to say that you can do it. The first step of initiating a conversation about sexual health is often the toughest part. This will take time and practice. It's not something that will happen overnight, but ultimately young adults want information about sexual health. Talking about the difficult topics leads to increased trust, honesty, and collaboration. Alright, and then this is my reference for the recognition model. I just want to say thank you for your time and thank you for listening.